Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Hi again, everyone. Time for our Thursday community service program. This week is Muenster Memorial Hospital Day on Thursday, and very happy to welcome back to the program Brian Roland, the CEO at MMH. How you doing?
I'm doing very well this morning. I'm very excited to be back.
Well, it's good to have you back as always. There's always a lot to talk about. First, I guess, top of the list, happy anniversary. You're celebrating your 1-year anniversary at MMH.
That is correct. Tomorrow will be my 1-year anniversary there. Very excited, very excited.
And as we were both commenting before we went on, it's hard to believe it's been a year already.
Yes, time flies when you're having fun.
Yes, and certainly I know some of it's been fun at least, but it probably, I would guess, Brian, it probably takes a good year to really get your feet firmly entrenched in something like this with the changes in healthcare constantly.
Well, and really with everything going on, you're probably looking at more of a 2 to 3 year process at this point, because if we were 10 years ago dealing with the changes that were going on with healthcare, yes, you could probably look at a 1-year scenario. But because things are changing so fast, not just from the federal standpoint, but with CMS and the state, you have all of the different pieces that you have to look at.
Yeah, and I think back 30 years ago in healthcare when I could walk into the hospital administrator's office and he was always reading something about updates on this, updates on that, and it's only gotten 1,000 times worse since then, hasn't it?
Well, and it really has, because back 25 years ago when I got into healthcare, you were looking at stuff that what was going to happen in 2 or 3 months. Now you're really looking at things that are going to be happening 2 and 3 and 5 years down the road as we look at Medicare shared savings and some of the other things that are going on in healthcare today. Yeah,
and let's talk about a few things that are going on, because I know one of the things that you are kind of concentrating on right now is physician recruitment. And without getting specific, because I know you really can't do that, talk a little bit about that. I know you're working on 1 or 2 things in that area.
Yeah, the physician recruiting has really been a struggle, and like I've told people in Muenster, we have received 54 resumes for our physician position, and my thing is, we could hire a doctor tomorrow, and I tell people this: if I hired just a doctor right off the street, you would go to him once, and that's not what we want. So trying to find the right doctor with the right fit, that will be that spark plug that we need in Muenster to really catapult healthcare to that next level takes a lot of time. So the benefit we have is we've had some really good applicants, some really good resumes, some really good people we've talked to, and actually we're in the process right now of some really hands-on negotiation with a provider that has an interest in coming to Muenster, and I'm really hoping this one is going to move in the right direction, and I have some positive news to tell people here in the next couple of weeks.
That'd be great. And I would guess recruiting's got to be difficult when it comes to healthcare, because you're right. You have to not only get a good quality physician, you got to get one with the right personality, attitude, and all of that to blend in a small community.
Well, you have that, and then the interesting thing is, if you look at the number of hospitals that are looking for doctors, family practice, and I'm not talking just in the state of Texas, but in the U.S., and not just rural, but you look at all the facilities, how do you sell Muenster, Texas, or Muenster Memorial Hospital when you're up against literally 852 other organizations and places at a minimum that are looking for that same doctor? And so that has been the interesting challenge. But with us, and one of the things I'd like to discuss, because my new year does start, is kind of my New Year's resolution and some of the vision, because that's what we utilize, is not what we've done in the past. Well, we have great quality and we're doing wonderful things in Muenster. What is our vision? What is our 2-year vision, 3-year vision, 5-year, and really, where do we want to be in 10 years? And if you can sell that vision, not only to a provider that wants to come on site to be your doctor, but as we're working with the specialty clinic, you have to sell that vision to them. That's how you build that foundation and move forward.
And in that respect, I guess, I've heard people in the past say, that the Muenster Hospital needs to grow, needs to get bigger, needs to do more. and that's not necessarily the key to success these days. It may be doing limited number of things and doing them well. Is that right?
You have to look at it in two ways. Sometimes you have to go backwards to go forward. You have to make sure that all of the things that you're working on are being done right, that foundation is there before you start adding things on. And so one of the things that we're really working on right now is, yes, we want to expand services, but it's within the services that we're doing already.
Right.
Okay, we can do stress tests and we can do nuke med stress tests. Well, if we have that equipment and we're not utilizing it to the fullest, let's focus on that before we bring in another piece of equipment that you have to pay a lot of money for. And then make sure that we're collecting all the money that's due us for those procedures and those things that are being done.
Mm-hmm. Yeah. And we talked a little bit about changes in healthcare, and of course that is all in pretty much dumped in your lap by the government, whether it be state or federal, mostly state at this point. And again, the legislature doesn't begin their next session until January, but you're already hearing of some health-related bills that are going to come up for consideration, right?
Yes, and a couple that could even hit before then that they're trying to push is CMS is trying to, because we're cost-based reimbursed, is to decrease our reimbursement by another 1%. Also limit the bad debt reimbursement, which is another way we can get a little bit of money on our cost report. So even before those doors open, we have those two things that we're dealing with. Plus, there is already 15 bills that are set to go to the floor that affect rural health care. Now, not all of them affect us directly, but if the doors aren't even open, and matter of fact, I'll be in meetings for a couple of days, the tail end of next week, to really start our game plan. And I know it's 6 months away of how do we mount our attack, if let's say we want to call it, on how do we fight these? How do we get the word out? How do we send emails to the people that need to know that, hey, you're going to kill rural health care if you keep doing this to us?
Yeah. I'm sure they hear that a lot. There's no doubt about it. And I guess on your side, it's good to know you're not in this boat all alone, are you?
And that's correct. We work with a lot of different people, Torch, the Texas Organization of Rural and Community Hospitals, the State Office of Rural Health, Texas Hospital Association, the American Hospital Association. There are all of those people out there, but it takes the effort of every single one of us CEOs to get the voice out to start moving forward to help make things happen.
All right. So in a nutshell, in the last couple of minutes we have here, Brian, talk again, kind of reassess or tell us again about your so-called New Year's resolution for your beginning of your second year.
Well, it's really 3 steps. The big thing we want to look at is, again, the most important thing for Muenster Memorial Hospital in our district is maintaining the quality of care we give our patients, because that is going to be the catalyst of what helps keep us alive down the road. Collecting the money that's owed us. Also looking at the expansion of the specialty clinic. Now with the grant money we have, we can add some more services and get that cleaned up and look really, really nice. Also working with our partners in the tertiary facilities on what can they help us with, what can they bring to our community that will help us expand services. Because if our goal is really why go anywhere else, how do we make that happen? And we can in Muenster. It can be done. Again, dealing with the governmental issues, working on all that. But then for me personally, my goal is what can I do better in year 2 as a CEO? We always try to get better. There's always things we can do better. There's not a perfect CEO out there, I'll be the first to admit, and I know this is on the radio and it's taped. But I have things that I need to fix, and whether it's doing community services, we want to do things where we bring the community into our hospital. There's just a lot of things we want to make year number 2 even better than year number 1 as we catapult into the future.
And you're already a step ahead of most for just admitting that. We can all become better in this world. No doubt about that. There's just too many people that don't admit it. And if everyone were that honest, we all might be better off.
Right
out of time. Thanks so much. We can visit about this all day, believe me. So we'll try to get together again next month, okay?
Great. And I look forward to coming back.
All right. Sounds great. He is Brian Roland, the CEO of Muenster Memorial Hospital, and that's going to wrap it up for our Thursday Community Service Report here on KGAF.